Yeah, just a quick review of the book, Examination Review for Ultrasound, Abdomen, and Obstetrics and Gynecology. And this is the third edition I'll be talking about. So what is it for? Who's it for? Well, basically it's to prepare you for your ARDMS, or the American Registry for Diagnostic Medical Sonography, and the ARRT, which is the American Registry of Radiologic Technologists. So the book is divided up into three sections. I'll go over each briefly just to give you an idea what's in the book, see if it's something you're interested in. The first one is Abdominal Sonography Review. Here they cover things like the liver, the gallbladder, pancreas, spleen, etc. Second part is the Gynecologic Sonography Review. Here they cover things like the anatomy of the female pelvis, the uterus, vagina, ovaries, etc. And the third section is Obstetrics Sonography Review. Covers things like the first trimester, fetal head and brain, fetal face, neck. Also covered, let's see, I think chest, just about everything. So anyway, a few key points about it. There's 60 review questions for each chapter, which is really good. And there's over 1,000 sonographic images and diagrams, so it's loaded with pictures. So yeah, I mean, if you're interested, if you need some help passing your boards, I think this would definitely be a good choice, as a review book. Something else I want to bring up, if you're getting into the sonography profession, there's a high rate of work-related musculoskeletal injuries as a sonographer, like shoulder problems, wrist problems, elbow problems, neck problems. So here's another resource I just wanted to bring up, easy exercises and quick fixes for sonographers with pain. Basically, it takes all the really stressed out tissues that a sonographer has. It starts like with the thumb, works its way up to the wrist, the elbow, the shoulder, the neck, the lumbar spine. Basically, this is a book of exercises and quick tips you can use to get rid of pain. Also, if you have pain, the exercise will help you get rid of pain. Otherwise, the exercise will help you prevent having any musculoskeletal issues. So I think this is good as a prevention measure. Before you get in the field, you start really overworking your shoulder. I'll just go over a few things real briefly. Starts off with like the thumb, just like a simple distraction technique. If you have like thumb arthritis or an overworked thumb joint, overworked joints love to be distracted. There's a couple of muscles that really support the thumb to help prevent thumb problems. Your abductor pollicis longus and your first dorsal interossei muscle. Has some exercises for that. It goes into the wrist, shows you a technique to instantly lower carpal tunnel pressure. Carpal tunnel is caused by increased pressure in the carpal tunnel, puts pressure on nerves and everything, gives you sensations in your hand and up your arm. So there's a simple technique you can use to keep carpal tunnel pressure down throughout the day so you don't run into that problem. Wrist distraction, just a whole bunch of stuff here. Stretching, wrist strengthening, how to strengthen your wrist. Just a couple exercises that you really only have to do a couple times a week. So you don't need to spend a lot of time exercising every day. Got a lot of tips for increasing circulation in the wrist. A lot of emphasis on the wrist since it's used so heavily in sonography. Things to increase circulation like contrast therapy, how to do giving yourself a self-massage for 2 minutes with a tennis ball. If you're to the point where you're really having problems and you need a splint to really rest your wrist, goes into that, what to look for with splints. The elbow shows you an exercise for tennis elbow. Here again, just hitting the major problems that sonographers have. The shoulder, really, you're looking at, to avoid shoulder problems, you're looking at rotator cuff strengthening. Because the shoulder is such a shallow ball and socket joint, it really depends heavily on the muscles to support it and keep it in place so you don't run into things like tendonitis, bursitis. And so the rotator cuff is really the main group of 4 muscles that stabilizes your shoulder joint. Get a strong rotator cuff, you're going to have a lot less shoulder problems. Shoulder sits upon a base, your scapula, your shoulder blade, so you got to have good scapular stabilization. That's something that's often overlooked when it comes to shoulder problems. And to give you some stretches, 4 critical stretches for your shoulder. And it ends with like the neck, gives you strengthening exercises, which has been shown to help with neck pain, some stretches. And it ends with the back, gives you some stretches for the back, as well as multifidus strengthening. So a lot of people know this, but the multifidus is the big stabilizing group of muscles in your spine. Out of all the muscles that give support to your spine, that stabilize the joints, the individual vertebrae, 2/3 of that support comes from the multifidus. So this is going to strengthen your multifidus, and also lots of studies studies showing that it's good to treat back pain. So even chronic back pain, you do multifidus strengthening, back pain gets a lot better, goes away. And great to avoid a problem too. Also been shown in some studies to actually prevent low back pain. So yeah, just a tremendous resource. Keep yourself out of trouble. But yeah, if you're looking for a good examination review book, for obstetrics, gynecology, the abdomen, I think this is a good resource. So definitely check it out.